This week, a Chinese citizen was found dead by apparent suicide in a contract processing center in Pennsylvania. He becomes the 11th immigrant to die in ICE custody this year, the most ever. Already, activists are calling for an end to the contract with that facility. But what exactly are the responsibilities of a detainment center when it comes to immigrants' health? 13 fact finders investigated. Arizona's Eloy Detention Center holds one of the highest populations detained by ICE in the nation. Like so many of these facilities, it's privately operated. That creates some gray area, says Darius Amiri, who's worked thousands of immigration cases.
So they have their own policies. They're accountable to shareholders. They don't want someone. I don't think they want someone dying on their watch, because it's not good for them publicity and shareholder wise. But you like that accountability to be uniform across the board.
ICE says one of the agency's highest priorities is detained alien health care. Standards require facilities to provide comprehensive medical, dental, and mental health care from the moment aliens arrive. Legally, detention facilities must follow the Constitution. That means no cruel and unusual punishment or denial of due process. Congress requires ICE to publicly report all deaths in its custody in 90 days. So we combed through every file for this year. All but 2 deaths occurred in contract facilities, including one at Eloy, an Ethiopian with no criminal history who died of tuberculosis. What is our government's responsibility in terms of taking care of the health of people who are in custody?
Yeah, it's an absolute shame for anyone to die in federal custody.
Among the others, causes of death included heart attack, suicide, seizures.
The issue here is that there isn't typically a lot of oversight, or as much oversight as we would like, as advocates, as people are concerned would like, when someone is in custody, or access. And I'm not saying there's none at all, but not necessarily the level you would like.
According to ICE, each facility must maintain written protocols in accordance with the ICE detainee death policy.
I think it's difficult to say with confidence that any law is being followed. I think it's going to be a case-by-case scenario. I can say that the clients I have visited in the detention centers here, I have not seen the kind of conditions I've heard about in other places, like, for example, again, the alligator Alcatraz. Thankfully, I've had access to my clients, but I don't think it's being consistently applied or enforced nationwide, and I think that starts at the top.
And one of the ways that they are trying to deal with that consistency is through announced and unannounced inspections and holding facilities accountable with punishments like fines. But several independent reports over the last decade show inspections are not frequent enough.